All right. Now we do the cryoglobulin associated glomerulonephritis. So we know the types of cryoglobulinemia and essential mixed cryoglobulinemia and the other types as well. So here we're talking about the essential or mixed cryoglobulinemia. Basically, this is vasculitis, okay, in all the vessels. It is caused by cold precipitable aminoglobulins, which is called as cryoglobulin. What is cryoglobulin? It is basically cold aminoglobulin. It precipitates at the cold temperature and it produces the symptoms and signs of vasculitis. Okay, cryoglobulin equals cold aminoglobulins, right? The most common underlying etiology is HCV infection. Yes, we know it. HCV infection. Okay, there is a clonal. Now, what happens in that? What happens? They're telling us the pathophysiology. There is a clonal expansion of B lymphocytes. B lymphocytes, clonal expansion of them. They produce what? You know, from the lymphocytes, B lymphocyte, we get the antibodies. These B lymphocytes, they produce IgM, which is a big immunoglobulin, IgM, rheumatic factor. Okay, if these are produced. Now, what rheumatic factor does? Rheumatoid factor, HCV antigen, and polyclonal anti-HCV IgG form complexes that deposit in the vessels and inside the inflammation. So, very beautiful thing they said. They say that what happens basically, what is the pathophysiology? The patient has a non-cancer HCV, right, one thing, and what happens? There is a clonal expansion of B lymphocytes. B lymphocytes are increasing their size, one, and they what do? They produce IgM antibodies plus of the rheumatoid factor. They make this. No, the combination of or accumulation of factor rheumatoid factor 1, HCV antigen 2, polyclonal anti-HCV IgG form. They just make a complex and they get deposited in the vessels and they do the process of inflammation. So this is beautiful pathophysiology of this condition. Now next they say that there can be the occult infections as well. For example, patient may have viral infection, some bacterial infection, some fungal infection, and they can have connective tissue disorders as well, right? And they can cause cryoglobulinemic vasculitis, right? Now they say what are the like clinical features, what can patient can have, like, you know, the vasculitis, it's a broad term. In vasculitis we can see lots of things involving from the skin, from the lung, from the liver, like I mean lots of things throughout whole body, the brains, okay, the new sensory levels, sensory system. So here they say patient exhibit purpuric and necrotizing skin lesion. I want someone to share the skin lesion of this cryoglobulinemia. All right, someone please just pick up the name, Dr. Azim, Dr. Furqan, anyone. Okay, just please do it. So patient exhibit purpuric and necrotizing skin lesions in the dependent area against the towards the gravity area, legs. All right. So patient number one, they have the rash. Number two, they have the arthralgia. They involve the joints. They may have this like constitutional features like fever. They can have the hepatosplenomegaly. These are all the things. Now, important thing yesterday we talked about, in cryoglobulinemia we have low complement level, right? And the rheumatoid factor is often elevated. Yes, because they just make a complex with the rheumatoid factor. So this naturally it's increased. Now, yes, we do the kidney biopsy. What happens in that? They show, yes, there are show several different patterns. Yes, in the cryoglobulinemia there are different patterns of kidney injury in the renal biopsy. Yes, there may be crescent formation, that is one thing, crescent formation. There is glomerular capillary thrombi, they form the thrombus, second thing. Fourthly, they can have full-fledged meningo-proliferative or membrano-proliferative glomerulonephritis picture, right? So these are three things which is very nicely written over here. Okay, crescent formation, uh, glomerular capillary thrombi, membranoproliferative glomerulonephritis. Now we go to the treatment. How to treat these patients? Aggressively targeting the causative infection. Aggressively treatment in these patients, because when we treat the cause, we will just going to get rid of this condition. Yes, here what we do, number one, treatment, gold standard treatment is we do the pulsed corticosteroid IV methylprednisolone for 3 days. Yes, we know it. One thing. And number two, we do the plasma exchange in these patients. And number three, yeah, rituximab is a beautiful medicine. It's very much helpful. And fourthly, we have the cytotoxic agents may also be used in these patients. when there's a little risk of exacerbating the underlying infection. Okay, or when there's no infections present, so we just try these things as well. All right, so this is all about cryoglobulinemic glomerulonephritis. All right, so yes, Dr. Najib has arrived.